Hey, Dr. Tam here. I want to show you how to use your Cervipedic pillow. This is for all of our current patients who have a Cervipedic pillow. If you don't have one, we have some in the office. But how you would use this is you're laying on your back. This is the top of your head, the middle of your neck, and also the base of your neck. This is for the top of your neck, the middle of your neck, or the back of your head. This is for the back of your head, the middle of your neck, the bottom of your neck. And when you're laying on it, you're using it just like so, okay? You can bring this on a plane, train, car rides, but for this exercise, you're going to lay on a nice and firm surface, all right? So while you're laying on this on a nice and firm surface, what you like to do is you always want to start off with the lowest setting, at setting 1. I want to show you how to actually change the settings. So when you do change the settings, you can usually, the easiest way is to put it on a firm surface. You press the 2 buttons down, and I want to show you here. The 2 buttons right here and right here. And when you press on it, it starts pressing up and it starts clicking. To bring it back down, what you like to do to bring it back down is you press this button towards that little exclamation mark and boom. I call it the Mr. Incredibles, or I call this the Incredibles mark, right? So what you can do is, once again, to set it the right way, make it higher, you press down and push up. To bring it back down, once again, press these 3 little lines towards the Incredibles button, boom, and you're back down. So how should you be using this? The first day, I like you to use this for about 5 to 10 minutes, all right? 5 to 10 minutes on this the first day, because I don't want you to get sore. I want you to fall in love with it and really like it and use it every day like I do. So 5 to 10 minutes the first day. We're still on the first setting, all right? Understand that these settings here, every click is half of a line. So listen for the click. Now you're at half a line. The next click, you're at 1 line. You heard 2 clicks, and once again, you're just on the 2nd line, all right? So now I'm gonna press it back down. So what you're gonna do with this is, while you're laying on this, 5 to 10 minutes the first day, 15 minutes maybe the second day, 20, 25, 30 minutes. Now, people ask me, well, Dr. Tam, can I go longer than 30 minutes? Of course you can go longer than 30 minutes, right? People who use this usually have a lack of a curve in their neck, or maybe a reverse curve, and you want to promote a normal curve while you're getting adjusted. Now, if you're using this, people who are outside using this that do not have a good chiropractor who's aligning your neck, this actually might be really, really sore for you because you're not getting that movement while you're using this. But getting back to our current patients on how to use this, once you work your way every day, increasing by about 5 minutes to 10 minutes, if you can make it to 30 minutes comfortably, now it's time to add 1 click. Listen for it, right there. Now you're at half a line, half a notch. You're gonna lay on this for now, instead of 30, dial it back to about 20 minutes. Go 20 minutes, next day 25, 30 minutes. And then once you hit 30 again, you can go up 1 click. And now you are on line number 2, all right? After the 2nd increase, now you go back down to 20, 25, 30 minutes. So on the 3rd day of line number 2, you can increase it once again. People ask me, Dr. Tam, can I lay on this for more than 30 minutes a day? Of course you can. Do 30 minutes in the morning if you have the time, 30 minutes at night. The harder you work on this, the more proactive you are, the better you're going to get faster, all right? Here's what I want all of our patients to do. Once you get to about halfway, between 3 and 4 on the 3rd or 4th line, right? Right about here, you're on the 4th line, all right? By the 4th line, you must bring this back in, and I want to see where you are at, because while you're laying on this, not everyone can go all the way to line number 6. Some people do well at line number 3, 3.5, or 4, and they just stay there. Some people do need 6, but I like to bring it in. I like for you to bring it in on one of your visits. We reevaluate to see where you're at and to see how much better we need to improve, what we need to do, make some changes to it. Some of our patients even bring this when they do their lower back decompression. They set it right here, 20 minutes of decompression while they're working on this. Well, there goes 1 session right there, 20-minute session. All right, I really, really hope this helps. This is exciting journeys.